My name's Louise Quinn. I'm a dementia navigator and I work for the Bristol Dementia Wellbeing Service. Basically it means that I sort of guide people and signpost people through their journey with dementia. It's not just the person with dementia, it's also their family and loved ones. So they come to me as the sort of first point of call, and I sort of know a lot of information I can sort of signpost them on to. They have a lot of questions, a lot of concerns at the beginning of first finding out about diagnosis, so I sort of navigate them through where they can get further help and further advice, and I hopefully answer a few of their questions for them. The navigator role is sort of a mixture between a dementia support worker and a dementia advisor. So we give that sort of emotional support, but we also sort of give that advice and signpost them on to where to find further advice. Definitely, in my team, we've got a multidisciplinary team. So with the navigator role, sort of intervention is that initial support and signposting. If there's a greater need with the intervention, I can then step up to qualified members of my team that sort of have clinical backgrounds, and they're the dementia practitioners. So initially I will sort of visit somebody, either the person with dementia or their carers or both. I can sometimes go in and meet a family all at once. I then sort of assess the situation and find out what the intervention required is. And if it's above my remit, I can then pass it on to a practitioner or seek the advice of others in the team, such as team medics. Or if it's a specific sort of need, I can go to a specific member of the team. It wouldn't necessarily be my practitioner. I could go to any of the practitioners who specialise in things like occupational therapy or learning disabilities, falls prevention. We have people that sort of are specialising in Down syndrome and dementia. That's quite a big thing that we're looking into at the moment. So there are sort of specialists within the team, so I can progress up and get that specialist advice depending on what the intervention is that's required. Mainly it's through their GP surgery. We work very closely with specific surgery practices. And then, so the GP will feed back to the person during the consultation. There's also a lot of literature around. We do various sort of information stalls at community events. We also sort of have our own website that people can access. We run various sort of social and activity groups through the Alzheimer's Society, and again we sort of signpost to the dementia service through those service groups. I facilitate a carer support group in Westbury-on-Trim, and I take a lot of literature along to the carers, and then they pass it on to their family and friends. So it's it's all about sort of spreading the word, and people are talking a lot more now about dementia, and they know there's a lot of help out there, so people are talking about our service a lot more. I mean, our service has been running since April last year, and within that time I've noticed that the word is out there, people know who we are, especially the term navigator, that's sort of being thrown around. People say, oh, I've heard about you navigators. So that's quite sort of, although it was an odd term when we first started, people say, what's a navigator? But it sticks, people remember the name navigator. So people are talking, and it's sort of spreading throughout the community, which I think is a brilliant thing. We've also got great sort of relationships with the GPs now, because with the GPs, they've got that sort of time restriction. They'll see somebody in a clinic for 15 minutes, they'll give the sort of facts, but then we can go in and support that GP and offer the more in-depth detail about their sort of prognosis. So it feels like we're supporting the GPs as well. But it is, sometimes people don't want to come to clinics or groups, or they don't want to sort of access the help, but whereas we go to their house or in their environment, we sort of, it's more comfortable for them. So I think that's what's important about our service. It's all very daunting in a doctor's surgery, and then when somebody comes to you and talks to you over a cup of tea, it's such a different experience for them. So I have to say, this is I've had various job roles working with sort of the public and in sort of clinical settings, but this has definitely been my favourite role. I can sort of have my own personal input on somebody's life. Everybody says, oh, they like to help people, improve people's lives, but I can actually do that every day in my job role. But I can do it in my way. It's sort of, our whole service is person-centred, and we care about the person, not just the person with dementia, but people close to that person. So I can offer my sort of personal input to that person with dementia and offer that support and advice, but also the family members. Everybody's different, even within sort of a family unit, everybody is different, and I feel that I can relate to each of them on an individual basis, so I can sort of see if somebody sat back and I can then involve that person. If people don't want to talk within the family group, I can sort of meet up with them separately. I sort of get an idea or feeling of who's feeling what, and I can provide that support. And I really do feel that I am having an input on people, and you know, the majority of the time people say, thank you, you know, I just wanted to talk to you, or I just wanted to ask you something, and they know that we're here at the end of the phone. And if I'm not there, one of my colleagues will pick it up and they offer the same advice. We've got some excellent admin staff that really provide that person-centred approach over the phone. They're really good. So yeah, it's just a reliable team, really.